It's time for Doc Talk Radio, brought to you by Gilbert Hospital and Florence and Anthem Hospitals. I'm Dr. Ann Borik, board certified in internal medicine, and I'm here to keep you up to date on the latest information pertaining to your health and well-being. Welcome to Doc Talk Radio. Today we have a very interesting show in store. I think this is going to be a very informative show. We have Dr. Bradley Neuswinder, podiatrist, in the studio with us. Bradley, thank you for coming.
Thanks for having me.
What I want to do is maybe have you introduce yourself, but before we do that, I just want to shout out to somebody that is a listener. And Tammy Stone Cipher from Oglethorpe, Georgia, I just want to say, hey, thank you for listening. Thank you for your support. Maybe you can call in and chat with us a little later. So, Brad, tell me a little bit about yourself.
Well, I'm a podiatrist. I've been in the Valley here for a number of years. I did my undergraduate training up at Utah State University in Logan, Utah, northern Utah. Then I went to California to the San Francisco School, where I had my medical training, and then I ultimately ended up in the Valley at the VA Medical Center up in Phoenix.
Oh, wow.
Where I did my 3 years of foot and ankle surgery training. And then I started practice in about 2003 out here in the East Valley.
Excellent. We work together. Actually, Dr. Neuswinder is the chief of surgery at Gilbert Hospital. And so we're colleagues, and I call on you often to help with patients. There's so many topics that I want to go over today because, honestly, as an internal medicine physician, what you do really, a lot of what you do is an outpatient practice, you know, bunions and corns and plantar fasciitis and the stuff that we really don't see in the hospital. Why don't we start with bunions? This is a big topic. Can you maybe just give us a little information on what it is, how to treat it, how to avoid it? You know, I was reading somewhere that high heels in women contribute to bunions. Is that true or false? So maybe you can kind of shed some light on it for us.
You know, that is true. High heels definitely will irritate a bunion.
Okay.
And more of the nature of the tightness of the shoe, the angle of the foot, they can definitely make one more sore. They can contribute to it.
Okay.
Bunions occur when the big knuckle of the foot gets out of position and gets sore and irritated.
Okay.
And it gets sore and irritated from activity, walking, running, also from wearing shoes, high heels, tight shoes, that type of thing, where it becomes prominent and then it doesn't align correctly. And when it moves, it hurts because it's malaligned, and also because it's malaligned, it's a target for shoe pressure, for tight socks, things that put pressure on it. And so bunions will hurt from wearing a tight shoe, from wearing a cowboy boot, from doing activity, running, jumping. A number of things can irritate it, both from just physical things where you're moving your body to things physically just putting pressure on it.
Now, let me ask you, is there a hereditary predisposition to bunions? Or not?
There is. It's you'd inherit a certain foot type from your parents, and that foot type could expose you to more risk of developing a bunion.
Okay.
And then your environment will also contribute to that. Type of shoes you wear, you're barefoot, not barefoot, whether you wear a supportive shoe, that also contribute to it. But yes, definitely some hereditary.
So how do I avoid bunions? If I were to, because I actually sometimes feel like, I think a bunion is coming on my foot. What do I do to prevent that? Are those little yoga toes good to kind of help straighten the toes?
The yoga toes are no good for that.
Okay, that's good.
Not long term. Short term they could straighten it when you have them on.
Let's explain to the listeners what the yoga toe little piece is.
Those little pads that will stick between the toes. Literally, just when the bunion, the big toe starts to move over, and the yoga toe just pushes it back.
Kind of straightens it back.
Correct. Yes.
Okay.
Yeah, straightens it back, and it's just a temporary thing where, the bunion's forming, and it's actually a maladaptation of a joint, and so it's becoming malaligned. It's adapting that way, and a yoga toe just isn't going to change that.
Okay, that's interesting. Is surgery oftentimes what is ultimately needed? Or?
Surgery can be. When people come in with a mild bunion, we talk to them about shoe gear, wearing shoes that are more appropriate, less high heels, less tight shoes, also more supportive shoes, less flip-flops. Arizona, of course, is a hot spot for flip-flops.
Right.
And that is warm here, and so a flip-flop is not as supportive. However, there are some flip-flops now that are a little better.
Okay.
However, they're just not as supportive, and so wearing a more supportive shoe will help with that.
Okay. So that's good information. Plantar fasciitis is something that we hear a lot about, and there's different schools of thought. I remember we had one of our physical therapists in the studio, and we were talking about ice, and rolling a bottle of ice, putting a bottle of water, making it ice, and then using that. As a podiatrist, what do you recommend for plantar fasciitis?
Plantar fasciitis is very common. Probably a quarter of everyone I see in my office has plantar fasciitis.
Wow, that's a big number.
Yeah. And it's irritation of the tissue in the bottom of the heel. There's
Okay.
a ligament down there that kind of helps support structures, and it gets inflamed, and little micro tears, and so it's kind of like a sprained ligament. And it's usually an overuse injury. It happens not just with one step, but thousands of steps where it gets inflamed. The more it gets inflamed, then it's just a process that continues. Now, things that contribute to it are going barefoot. Again, Arizona is a hot spot for that, with flip-flops, and that's the first thing that a lot of times I talk to with my patients about is you got to stop wearing flip-flops. You can't go barefoot.
Really?
Okay. And so things that kind of help prevent it is wearing a good shoe, making sure that we stay limber. Most people will go throughout their day and they're active to a certain degree, but they don't do a lot of stretching. And as time goes on, things just tighten up, and the foot and ankle will get stiffer. And as it gets stiffer, it can also lead to some of that as well.
So, are there exercises that you would recommend to kind of stretch out the plantar fascia underneath the foot?
There are. When someone comes to my office and they have plantar fasciitis, they typically give them an instruction sheet about some stretching. One is a simple wall stretch where you stretch your Achilles tendon up against the wall.
Okay.
The other thing you kind of almost mentioned as well is rolling your foot on a frozen water bottle or a tennis ball. That kind of stretches out the tissue on the bottom, helps loosen it up as well. Okay. Nice thing about using a cold water bottle is that will also help ice the area as well.
To decrease the inflammation. Right.
To decrease the inflammation, exactly.
How often do you find yourself injecting with steroids?
Probably at least half the time. Where sometimes it's just so inflamed that it's hard to make progress at calming it down without a little bit of cortisone or steroids to help with that. Some people are afraid of needles, and so we don't do it. But if people are okay with that, probably half the time we'll inject with some cortisone to kind of help the whole process, especially if we're treating them and they don't seem to be making progress.
Right. For those of you listening, previous shows we've talked about barefoot training. And there's two schools of thought from what I'm seeing. And I would love an opportunity to talk to a podiatrist as yourself. And what do you feel? What is your recommendation? Initially, my thought was barefoot training. I would never consider doing that just because of the risk of injuring the foot. But then as I read more and looked at some of the research, they have a good point.
Yeah.
What are your thoughts?
The barefoot training is very interesting. People ask me about that. The first thing I tell them is that it's something you can do. You have to be very disciplined, and that it's something you have to gradually get work into.
Okay.
People that are larger frames have a harder time because there's just more mass and more weight going through their foot. But barefoot training is something where it's an altered running style. Instead of you striking your heel first and rolling off your toes, you kind of strike with your foot almost flatter. So you get different mechanism in the foot, which allows the forces to go through differently. Different shoe people wear. The one thing about barefoot training that's tricky is that there's an argument about barefoot, and that years ago we were all barefoot. And years ago when we were all barefoot, we didn't walk on tile and cement, and so things have changed. And so if you are barefoot training, you need to be more mindful of your environment and the surfaces you're on.
Right.
And that our shoes that we have now absorb energy, and that's because instead of walking on the ground, we're walking on concrete and tile and that type of thing.
I was under the impression that the whole theory was that it helps strengthen the small muscles in the foot.
Yeah, that is part of the process.
So that it doesn't become lazy.
Yeah. It's a different, that's part of it. There's a different gait cycle that you go through, and the idea is that you will gradually make those muscles work harder, and they'll get stronger.
Exactly.
And the argument is that on the other side, wearing a shoe and a supportive insert will cause those things to become lazy. And so that is the idea behind it, is that you will have a different way of running, and your muscles will be trained as you go through it.
Flat feet is kind of interesting, and my people who have flat feet really should not be walking barefoot. Is that right, or is that a truth, or is that false?
The thing with it is that if your feet don't hurt and they're flat, I really don't care what you do.
Got it.
And some people can get away with that. They have the flattest feet in the world. They never bother them. They can do whatever they want, and that's fine. But once they start to develop pathology and they hurt, then that's when we have to start changing things, changing how the foot functions. If you come to my office and your feet are flat and you have pain, I tell you, wear shoes all the time.
Right.
If you come to my office and your feet are flat and they don't hurt, I don't really care what you do because they don't hurt. And typically we just treat the pathology for the most part.
I know you brought actually a foot here, which is really neat. Can you show it? You talked about the heel and where the plantar. Where on the?
Oh yeah, sure.
Just so that our listeners can get a picture of what it looks like.
As far as the plantar fascial ligament that we mentioned earlier, it inserts through here and kind of goes to this direction through here. The thing that happens to the foot is that we have a little arch through here. As it flattens out, it can strain that ligament. It can strain some other structures and make them sore.
Right.
But yeah, that ligament that gets sore is just right under here, right in the base of that heel, and it goes up towards the toes.
Okay, that's good. That's interesting. Morton's neuroma, being that you have the the foot in your hand there, can you speak a little bit about what really is Morton's neuroma? How is it diagnosed? How do you treat it?
Yeah, with Morton's neuroma, there's a nerve specifically when we refer to it as Morton's. It's this interspace through here. People can get neuromas anywhere in the body, actually, where the nerve gets irritated and some scar tissue forms. But Morton described a nerve in this interspace through here, where there's nerve roots that go through here and they get irritated by the structures between the knuckles and they become inflamed.
Right.
And scar tissue gets in there and they get sore, and then the more inflamed they get and the larger they get, the more of a target they are. And so they hurt more when we walk on them.
So predominantly it's between the third and fourth toe.
Yes.
Is that what you're...
If it is a true Morton's neuroma, yes.
Okay.
People can develop it between the second and third. Mm-hmm. We call it neuroma because technically Morton described it as the third interspace when he described it.
And so you can get a neuroma really anywhere, is what you're saying.
Correct.
My understanding is that it feels like you're walking on marbles. The sensation. How would you describe? What is the pathognomonic, classic history that somebody would tell you in order for you to make the diagnosis for Morton's neuroma?
Oh, specifically when people are describing walking on marbles, well, sometimes people will actually feel the inflammatory process around that nerve.
Okay.
I had a patient recently who described that same exact thing, was that he's walking, it feels like something shifts, and gets caught under there and it hurts. Mm-hmm. And actually with Morton's neuroma, when you're doing a physical exam, you actually will squeeze the foot and feel it, and you can actually feel it pop back and forth.
Uh-huh.
Sometimes it makes a noise.
Okay, so that's how you diagnose it. Is it pretty classic to have pain radiate, down to the toe?
Yeah, with the Morton's neuroma, it is in an area of the foot that there's a lot of anatomy, tendons, joints, joint capsules, and then there's nerves. And one of the things that we use to differentiate is the symptoms, how people describe it. Mm-hmm. The first thing with the Morton's neuroma is that it can hurt you with shoes on. It can hurt you when you're active, when you're sitting there. It can kind of come and go because it's a nerve that gets irritated. Mm-hmm. And when you do feel it, it feels more electrical, burning. Sometimes people describe it like a funny bone feeling when it zings to the toes.
Okay.
Sometimes people describe it as being numb down there. And these are all kind of presentations of a nerve. Mm-hmm. When a nerve gets irritated, it can kind of administer or it can be burning or tingling or a sharp pain, but not usually a dull ache. Like some of the other things that can go on there.
And what do you recommend? What is the first line of treatment, and how do you treat it?
With the Morton's neuroma, the first thing is make sure people don't have on tight shoes because that can really irritate it.
Okay.
If you can imagine, on the foot model here that we showed you before, if there's a nerve in between these knuckles here that's sore and we compress the foot, it's just going to pinch it even more. And so that's one thing that we start with is a wider shoe. After that, we talk about supporting the foot better and making so there's less motion to the front of the foot. We quite commonly...
Like an ACE wrap? Or?
You know what? No, more than that, just a supportive shoe and even a foot orthotic.
Okay.
And we haven't really talked about foot orthotics yet, but that is something that it's an insert that goes in that kind of supports the arch, which will minimize some of the extra motion through the front of the foot through here, which can help alleviate some of that irritation. We also use physical therapy on Morton's neuromas. We quite commonly will inject them with cortisone to try to shrink that inflammatory tissue. And if they continue and they don't get better, then sometimes they'll even be surgically freed up. Something's called a neurolysis, or sometimes in the last extreme be resected, a neurectomy, cut it out,
right.
Which is the last resort, of course, because then you're going to have permanent numbness. But permanent numbness is sometimes better than pain.
Exactly.
Correct.
I think of it, we have a question here, but I just want to finish this thought. I think of it as almost like a carpal tunnel situation. Sometimes, you have that shooting pain, that neuropathic type pain, and we treat those people oftentimes with vitamin B complex, B6. There's been some studies showing that B6 helps to regenerate the sheath around the nerve. Has that been looked at in Morton's neuroma at all? Do you know?
No, not as much. There has been some thought towards that where traditionally we should just cut the nerve out, a neurectomy. Recently there's been a lot more momentum for doing a neurolysis, or just freeing up the tissue, similar to what you do with a carpal tunnel. And then after that, there are other supplements and whatnot that people will use to kind of help augment that.
Very good, very good. Joe, we have a question.
Yes, we do. One of our listeners out there would like to know, what is turf toe that sidelines many football players?
Okay, that's a good question. Turf toe basically is an injury to the bottom of the big toe joint. I'll show you kind of on my foot model here. So there's the big toe joint, and there's tissue all around it, kind of keeps it in place.
Right.
Unlike this foot model, it doesn't have an elastic band inside, but it has soft tissue around it. And on the turf, sometimes players can experience injuries where this toe gets jammed up through here, can cause damage to the bottom of the knuckle, and can literally tear that tissue.
Oh, wow.
And so they call it turf toe. And one of the reasons why it happens with turf toe is the shoe gear is different, the the surface is harder, and you can get those as kind of a hyperextension injury where the big toe goes up in the air and will damage the structures in the bottom.
Wow.
In severe cases, sometimes it even needs to be surgically repaired. However, usually it's just some tears there, and rest is usually the
rest,
the process.
ice, anti-inflammatories, those kinds of things.
Yeah, to kind of help it heal.
Do you ever recommend maybe taping it or supporting that structure a little bit more in football players? That
as far as turf go?
Yeah.
No.
Okay.
It's just a thing where, there's not anything you can put on there that's strong enough that's going to alleviate that type of force that would tear the tissue.
That would tear that tissue. Okay, that's a good question. Yes.
Is there a shoe that you recommend for Pat in Chandler, who just called in? Says she has hammer toe and just poor foot health in general. Do you have a shoe that...
I do. I really like the New Balance shoe, in that they generally have a nice, healthy toe box. And the toe box is the part of the shoe that goes over the toes. They also come in a variety of widths, and so they can accommodate feet better.
Right.
Now, a New Balance shoe will come with a variety of different types of shoes. Can give more support. What's called a motion control shoe versus just a traditional shoe that offers more cushion. But in general, there's a lot of diversity. And that was Pat and Chandler. There's a New Balance store actually in Chandler, kitty corner from the Chandler Mall, where they have good staff there. They can measure foot, probably find a shoe that would be real nice.
Wow.
Could accommodate some hammer toes and whatnot.
Very good. That's a good question for people looking. While we're talking about New Balance and so forth, let's talk about athlete's foot, because that's something that a lot of people ask about and question. Athlete's foot goes along with fungal nails and those kinds of things. Why don't you give us a little information about that?
Yeah, athlete's foot is just from a fungus. The most common organism is called Trichophyton rubrum. There's another Trichophyton metacrophytes that can cause athlete's foot, and it's basically a fungal infection that gets in the outside layer of your skin.
Right.
The very outside layer of the skin is dead, and it will eventually slough off, but the fungus can get in there and basically live on that tissue, and itches. Sometimes can be a little red and irritated, and typically responds quite nicely just over-the-counter antifungal medications. Now, the fungal nails is a similar process now, but it doesn't involve the skin, but involves the nail tissue itself and lives between the nail plate and the underlying tissue underneath, and can make the nails thick, discolored, crumbly, a little more challenging to chase away because it is kind of buried underneath that nail plate.
Right.
Topicals can work. They work less
Not
well.
as effective, right?
Not as effective. They take a long time. It's just harder to penetrate. Usually there's oral medication that can work with that. Now, the problem with toenails is that they can get the athlete's foot fungus, trichophyton, in there, but also a variety of other ones. They can even get a mold in there, a number of things that sometimes don't actually respond to the pills as well and require sometimes topical or even sometimes removing the toenail.
Right. So what would you recommend? What is the first step to preventing?
Yeah.
So some of the things that people listening may have high school kids that are athletes, or, we're on our feet day and night. What would you recommend that we do?
A few things we recommend. One is when you're in a public place, wear a flip-flop. Even though flip-flops aren't supportive, but they're protective.
For this?
Yes.
Okay.
The other thing is that if you have someone in your family that has it.
Wait, let's go back to them just so that so if you're in a public place where you normally would be barefoot, is that what you're saying?
Yeah.
Swimming pool, in the,
yes.
That kind of thing.
Yeah, it's just nice. It gives you a barrier in that it's around and you can pick it up. It's contagious. It's not horrifically contagious, but it is something where if you're in an environment, a public shower where other people have athlete's foot, you may pick up the fungus and get it into your skin.
Right. So you always want to protect by keeping your feet.
Yeah, it just gives you a barrier. Having a flip-flop gives you a barrier between you and potentially some fungal elements that are around.
Okay. And then, I'm sorry, what else were you saying?
Oh, then just, if you have someone in your family that has it, if you get in the habit of, in your shower, cleaning it, even a little spray bottle with some dilute bleach in it, spraying in the bottom will kind of help keep those elements down as well. Okay.
What about treating the shoe? I mean, I know that if once you have it and you have shoes, it's probably a good idea to get rid of those shoes, right?
It is, because you could reinfect yourself. There are some places that actually will actually sterilize shoes.
Oh, really?
With these radiation to do it. I've heard, and I don't have any scientific evidence to this, but you can freeze your shoes. Again, take that. Yeah,
right.
Who knows, right?
So if you find your shoes in the freezer, beware, right?
Yeah, right. Yes. As a general rule, if you have some shoes that are old enough that picked up enough fungus, just get rid of them and get some new shoes. In that, it just gives you a chance to hopefully not reinfect yourself.
Okay. Light socks, dark socks. I know that I was always under the impression that, light, white, cotton, airy type, socks. You don't want to avoid the dark socks. Is that true?
That's an interesting question. And I'll tell you a story from when I was a resident at the VA. I taught a diabetic course.
Okay.
And there was also discussion about wearing white cotton socks and what are the magical properties that these socks have.
Right.
And there's nothing about them, but why you wear a white sock is that a white sock will show something on the sock, some drainage. And so if you're diabetic and you wear white socks, if you happen to step on something, if you get a sore, you'll see it on your sock because it's white. However, if you're wearing a dark sock, you just won't see it. And so color only is if it will show some type of drainage. And so if you yourself, for socks and you don't have any, diabetes or anything like that,
it doesn't matter.
It doesn't matter.
Okay. That's a good pearl for those of you listening that are diabetic, specifically to be aware that maybe, that would be the reason to wear white, light-colored socks.
Correct.
Because oftentimes in diabetics you have peripheral neuropathy, which maybe we can talk a little bit about, where you don't feel pain. So if you step on something and you have an ulcer that bleeds or has pus that's infected, you may not know. We've had patients come in that totally are oblivious to what's going on the bottom of their foot until it fungates. So the white sock really allows you to see if there's a bleeding or something happening that you may not feel.
Yeah, absolutely.
So that's interesting. Very good. Joe, did you have a comment or
yes,
question?
We've got a couple of calls here that questions. Jamie and AJ has had warts 3 times removed from the bottom of her foot. Wants to know if she's always going to have to live that way because they continually reoccur.
Warts are tricky. Warts are a virus, human papillomavirus, and they get in a crack in your skin. They form a little viral tumor. The thing about warts that's tricky is that they are an infection, but they don't penetrate deep enough that your body actually sees them and fights against them.
Right.
And so they have to be removed by different means. There's a bunch of ways to treat warts, freezing them, burning them. I actually sometimes inject warts with chemotherapy, bleomycin, to kill them.
Wow.
Sometimes we take them to the operating room when we dig them out. We have found that if someone is susceptible to warts, gets warts, they may recur. However, if they're recurring in the same place, then perhaps they haven't been properly eradicated.
Right.
But they can take time. If someone comes to my office and they have one solitary wart, I tell them it's going to take between probably 2 and 4 treatments. We treat them every 2 weeks, which means one wart could take 1 to 2 months to get rid of, treating it every 2 weeks.
I have to share with you a personal story. This was years ago when I was actually in high school. And I was an athlete and in the martial arts, and I was barefoot a lot, and I had warts on my foot. And they wouldn't go away, and finally I went to a foot doctor who was doing there was a investigational study. And what he did was he said, I'm going to cut one of the warts off, and I'm going to bury that wart in your skin. So he took a little wart out and then made an incision and buried it on the side of my foot in my skin, deep enough for my body to develop antibodies. And literally all the warts fell off and never came back.
Yeah.
Are they doing that? Or
I have never done it personally.
But have you heard of that?
Yes, I know podiatrists that have. I haven't read anything that's compelling enough to say that's okay.
Right.
In my mind, that seems tricky because you put a virus inside the skin. But yes, that's the idea behind it, is that you will make your body aware of the warts and launch an immune response against it, and kick them off.
Yeah.
It's not routinely done that I'm aware of.
Okay.
Again, I know of people that have done it here in the Valley.
Okay.
I've talked to them about it, and they claim it works.
Yeah.
I haven't adopted it for myself yet.
Okay.
But it is something that's been done before.
Interesting. That's warts. That's interesting. More questions.
Got one more question here. Mary, Denver, Colorado, has been having major foot problems ever since the airport, when she was traveling, made her remove her shoes and walk through the checkpoint. Is there anything you can recommend for people traveling?
Yeah, that's tricky when you have to remove your shoes and go through the checkpoint.
Right.
I guess the only thing I'd recommend is get through and get your shoes back on as fast as you can. And then also just, they don't let you carry anything through the scanners, but just make sure you don't spend a lot of time. You don't carry anything heavy. If there is a concern, before you pick up your bags that go through, maybe put your shoes on before you start carrying something heavy.
Right.
With barefoot.
I would bet that it's probably in that transition time when you're trying to gather everything. You're getting your shoes and you're putting them under and you may torque and twist and injure. So I would be very careful with that.
Yeah.
That's a good point. That's a good question. Joe, do you have another question before?
Nope, we're good right now.
Let's talk about diabetic foot.
Yes.
Okay, because I think this is huge. We see a lot of infections and wounds, and that's really why I call on you in the hospital. And by the way, Doc Talk Radio is sponsored by Gilbert Hospital and Florence Hospital at Anthem. So it's just a great place to work. We're colleagues there. So talk a little bit about the diabetic neuropathy.
With diabetes, as diabetes will progress, and some of the complications, one that we see in podiatry is peripheral neuropathy,
right,
where the nerves themselves can be affected by the disease, where they literally are damaged to the point where they stop functioning and they don't send the signal correctly. Now, the reason why that's tricky with a diabetic is that it leaves you exposed to an injury that you're not aware of, I routinely have patients come to the office that have toenails that are black and blue, little cuts here and there, and they don't know where they came from.
Right.
One of my most interesting stories that I recall is when I was a resident, and again I trained at the VA up in Phoenix there, and we had patients come in, and one gentleman came in and he had literally a hole, maybe the size of a dime, on the bottom of his foot.
Right.
It was infected, and we had to basically treat that and whatnot. But how it happened was 2 days before, he wanted to go to the hardware store to buy something.
Wow.
And he couldn't find his keys. And so he got his spare keys, drove to the hardware store, came back, and then went throughout the day. And then finally later that night saw his wife and was kind of mad at her and chastising her, "What did you do with my keys?" And she's like, "Well, I threw them in your shoe."
Oh.
So then he takes the shoe off, and literally his keys were in his shoe. He didn't feel it, and it caused pressure and caused an open sore.
Oh, my.
Fortunately, he ended up losing part of his foot because of that, because the infection got worse and got into the bone and stuff.
Oh, wow.
So it is something where you think, oh, you have a numb foot, why is that such a big deal? Well, that's why.
Absolutely.
You just don't have that protection to be aware of that, and that's why the white sock is such a good idea in that you take your sock off, you see a stain on there, then you can see it right away because it will show up on the white sock.
Exactly. For those of you listening, neuropathy, what happens is people who have diabetes, especially diabetics who are not well controlled, develop, for whatever reason, infiltration into the nerve, if you will, and it becomes to the point where it doesn't work. So that nerve doesn't send signals back to the brain to tell you that there's pain or there's sensation, and that's what we call peripheral neuropathy, meaning that the nerve is affected peripheral outside of the brain. And that's a big problem. That's probably what you see most, I think, in the hospital when we call on you. I would
yeah,
have to
absolutely.
Say.
As far as consults that are at the hospital, is that type of issue.
What can you tell our diabetics listening to do, in terms of, is there like a regimen? Because I know, as a family doc, internal medicine doc, we always have the diabetics take their shoes off. Anything that you can specifically give them advice to that?
Absolutely. The first thing, of course, that I'm sure you recommend is just absolutely tight glycemic control, just making sure the sugars are great,
right,
to limit the complications. But they will happen, and if they do, then as far as the feet go, get in the habit of just checking your feet every day. We actually recommend if you have a mirror, well, if you have a buddy, they can look at it. But if a mirror looking at the bottom of your feet, looking between your toes, making sure you dry well between your toes so you don't get any fungus.
That's a good point. Checking your feet every day. That's huge.
Yeah.
And looking in places where you can't see.
Yeah, looking for things that seem abnormal. Anything that's not pink or flesh color.
Normal looking.
Yeah.
Right.
Yeah, that's something that you need to have checked right away. Then another thing is making sure you try to wear shoes as much as you can, especially outdoors.
Right.
If you have diabetes and have some sensation changes, outdoors is a place where you can get a lot of problems stepping on things, thorns, anything that's sharp and harsh. We do live in a desert here in Arizona, and so that's something that I always recommend. And then, and as far as shoe gear goes, I'm a bigger fan of closed-toe shoes for diabetics as opposed to flip-flops because they can protect the toes more. But at least the flip-flops is something to give you some protection, so something on your foot when you're outdoors.
Right. So virtually never go barefoot as a diabetic. That's what I'm hearing, and that's what we recommend.
The more you wear your shoes, it'll be better. And that you can, of course, step on something. The other thing that happens with diabetes and with neuropathy is you lose the ability to kind of know when enough is enough, so to speak. And so you develop more pressure spots. You can develop calluses. Calluses can continue and get thick to the point where they can actually cause open sores,
right,
which can get infected. And a shoe helps kind of prevent all that.
Right. And the reason the medical community is really adamant about diabetic foot health is because if you haven't seen a diabetic foot ulcer, it can lead to amputation. It can cause infection throughout the entire body. And people die from that.
Yes.
So that's why it's something simple that can be done and taken care of.
Yeah, absolutely.
Good. You have a question?
Gil from Panama City.
Panama City.
Panama City.
All right.
Lost his big toe big toenail in an accident, and he is diabetic. Says his big toenail will not grow back properly. Is there something he can do?
When you have an accident and have some trauma to the toenail and it gets ripped off, it can sometimes damage the nail plate itself, the nail matrix where it grows from. If there was damage to that and the nail's growing in thick and improper, it's probably permanent. Sometimes if the nail grows back thick, we will sometimes remove it. As it grows in, we'll put lotions on it and just see if we can kind of baby it and see if it will come back. However, usually if there's damage to the nail matrix, it will cause the nail to be thick permanently.
Wow.
If it's an issue where the nail's super thick, it's problematic. Sometimes we'll just remove the nail matrix and kill the nail so it doesn't come back. And that no nail is sometimes better than a nail that's thick and problematic.
What is the procedure in killing the nail when you say that?
You know, we remove the nail, the nail plate, and then
So it's a surgical excision?
It is. We do it in the office. It's one where we do it in the office. We of course, we anesthetize the digit. We move the nail plate out of the way, and then with usually acid, we use carbolic acid or phenol, and we cauterize the nail matrix so it doesn't grow back. It takes about a month to 6 weeks to heal, and then you're left with just a toe with skin and no nail.
Right. Right. But at least it's the potential for infection is removed.
Yes.
Okay. You know, while we're talking about toenails, I know that there's different appearances of nails, even fingernails. Can you speak to what a club nail may look like, or what is it, cupping or spooning of the nail?
Yeah, there's different shapes. The normal nail is slightly curved. A club nail is one that, if you imagine the end of the club is kind of round, thick, and bulbous. That could come from fungal nails. It could come from trauma. There's different diseases that can cause it. Psoriatic arthritis routinely will lead to nails being thicker.
Right.
They usually will have a pitted appearance. Other nail shapes, one that's very problematic is the omega nail, literally shaped like an omega. Where the edges kind of pinch around.
Okay.
They can be painful because the edges pinch. It also will predispose you to getting ingrown toenails.
Ingrown toenail, right.
Other nails, sometimes people...
Well, let me stop you, though. What does that mean? I mean, is that characteristic for any other systemic disease, or is it just more localized?
As far as the omega shape?
The omega shape, yeah.
Not that I'm aware of.
Okay.
There are some, like the pitting of the nails is really common for psoriatic arthritis.
Right.
The omega nails, just as people age, sometimes the nails will change shape a little bit.
Okay.
But nothing that's systemic that I'm aware of as far as any correlation at all.
Okay. Ingrown toenails.
Yeah.
What do you do? How do you treat that? What's the...
Ingrown toenails are tricky in that they're very painful. If you haven't had one, you haven't lived until you have, because they're very sore and it's such a small little area. And the problem is that I don't know if people can relate to thinking about stepping on a little thorn or getting a sliver in your hand. It kind of gets red and festers and it hurts. And it hurts and hurts and hurts until you pull that little thorn out. Well, ingrown toenail is literally that, in that edge of your nail is digging into your body, causing a foreign body reaction. And that foreign body reaction hurts, can become red and inflamed, sometimes some drainage comes out, and ultimately it can get infected. And to treat it, basically, you have to go in there and physically remove the part of the nail sticking in. And so if you have ingrown toenail, occasionally you can soak it, you can baby it, it'll go away, but usually it requires trimming that edge, because that edge is literally a foreign body and your body's responding to it with an inflammatory process, which is pain and swelling.
Just while we're talking about that, there's the nail salons, and I go and get my nails done and my toes and all of that. What do you recommend for your patients? First of all, do you see a lot of complications from that? Is there a high incidence of infections and so forth?
Occasionally I do. Sometimes I see the most common things is occasionally the nail edge will be trimmed and there'll be a spike left and the ingrown toenail comes.
Okay.
Occasionally I see actually heat burn from them rubbing calluses off.
Okay.
Some people will catch a fungal infection there.
That's my question. Is that prevalent? I'm asking you that because I want to know. What do you recommend?
The thing that happens is that nail salons sometimes have the chairs you sit in and you soak your feet in them and they swirl the water around.
Right.
And they'll drain it and they'll wash it real well and sterilize it, but they don't change the filter. There's a filter that needs to be changed between every patient, and that will collect debris. So nail salons, just make sure that they use good technique, they clean their tools. And if they do, then you're fine. Now technique as far as leaving a little nail spike, that happens. I'm sure that I've trimmed nails before and left a spike and given something your toenail. As a general rule, just make sure that you go to a place that they use good technique. They sterilize their tools, either cold sterilization.
Now, would it be reasonable to ask them if they change the filter?
Sure. Yeah.
Okay.
You can,
So those of you listening, that's important to know.
Yeah, that's a big thing that they found with the spread of of
infection.
Infection is that filter is kind of the one where they're draining the water, they're washing it well, but there is the filter that goes through that needs to be changed as well.
Okay,
that
good.
can lead to some of that.
That's good information. Yes, Joe.
Got a couple of interesting ones here for you.
Okay, good.
Right.
Betty from Florence says her husband has incredible foot odor problems.
Okay.
And the doctor has said, do not wear any color but white socks, and that will help. And she said, nothing helps.
Okay.
Any advice?
Yeah, foot odor is usually from the actual bacteria that get in there, and they produce toxin, and that's what we usually smell. Sometimes we can even see on the bottom of the foot little pitting. It's called pitting keratolysis. It's a little superficial bacterial infection, and it's usually a combination of the odor that you smell is from bacteria and also fungal. White socks will help. They can breathe. I sometimes recommend people buying diabetic socks that are laced with silver. Silver is an microbial. It will kill fungus and
Where do
bacteria.
you get that?
I just have people go online.
Okay.
I'm sure if you go to some of the places, Arizona Walk Shop here in town may have that type of thing. Some of the hanger places may. However, I don't know for sure, and so I just have them just.
Okay. So what is it called? Diabetic foot socks?
Yeah,
or?
Diabetic sock that has silver in it.
That has
Literally,
silver.
It'll just have little threads of silver,
Okay.
which will help kill bacteria and whatnot.
That's good to know.
They have some at Walmart,
Yeah.
actually.
Oh,
My
really?
wife actually picked some up for me. They're the most comfortable socks I've ever worn.
Yeah, they're more
Excellent.
prevalent, and usually they don't have a seam in them and stuff.
Okay.
The other things is making sure just, if your feet swell a lot, that can be part of the odor, is that the moisture that's there, the bacteria will live on that, some of the oils that come off your skin. And so making sure you just wash your feet well. Sometimes you have to change your socks throughout the day. Make sure that you have multiple pairs of shoes, and that every day as we go through the day, our feet will sweat a certain amount. A teaspoon, 2 teaspoons of fluid into our shoe. That takes time to dry. And so a lot of times just overnight, the shoe doesn't dry well enough, and so having multiple shoes will help.
Right, because we don't want to be we don't want the foot to be in a moist
Correct.
environment. Powder, would you recommend powdering the foot or the shoe
powder
or anything?
helps just absorb moisture.
Okay.
You can also buy some medicated ones that will help with that. I also sometimes have people use spray and antiperspirant.
That's what I was going to ask next. Yeah, so
to help with that.
to spray an antiperspirant on the foot
Yes.
itself.
So it doesn't sweat as much.
Right.
Because the problem is the sweat.
Right.
And so if you imagine fungus and bacteria, they love warm, moist, dark environments. So if you take that foot, you get it nice and sweaty, put it inside your shoe, wear it all day. It's a perfect environment. Yeah.
Right.
And so we just want to try to interrupt that as much as we can. I sometimes have people change socks and shoes even throughout the day. But it is something where we need to control that sweating and just keep the sweating down and keep the foot clean as we can and dry.
Right.
And also, it may kind of sound funny, but people need to wash their feet. Most people will shower and they don't ever wash their feet. It's just too far away.
Right.
Probably men are more culprits than women are. But just washing your feet, making sure we get any excessive oil, debris off, that type of thing.
Keeping it clean.
Yes.
Even maybe soaking the foot, in a warm, sudsy, soap
Yep.
kind of.
Getting it
That
good
would
and
be
clean,
good
yeah.
to get it clean. Yeah, good. Very good. Next question.
We have Lynn and Chandler, and first of all, I've had a couple people ask for your contact information
Okay.
already. So if we can give that out, we'll get to that question from Lynn.
Okay.
Yeah. As far as the location, I have an office in Gilbert, on Gilbert campus, Gilbert Hospital.
Right, which is South Power Road. The hospital, Gilbert Hospital, is at 5656 South Power Road. It's the hospital with the helicopter on the top, on the roof, and it's in that complex.
Yeah, in that complex, and I'm in Suite 124.
Okay.
Our phone number there is 480-840-3457. And then we have a second location on the campus of the Banner Ironwood Medical Center in Sandan Valley, just right there on campus. There's one medical building. We're on the second floor.
Excellent.
In there. And the one phone number reaches all those locations.
All of those
Yeah.
locations. And hopefully as we build out at Florence,
Yeah.
Hospital at Anthem, hopefully you'll be in this area as
Yeah,
well.
absolutely. Yeah.
Very good.
Yes, and Lynn's question. Lynn loves her salon that she goes to and
Yes.
gets her pedicures. They have recently started doing a technique. Her friends are scaring her, saying that it's not good. Get out of there. Go somewhere else. They put her feet, if I understand this correctly, in with fish and water.
Yeah. Yeah, that's interesting.
I've never heard of that.
Yeah, what it is they're little fish, and I can't remember the name of them, but they actually will eat off the dead layer of skin. And so they just you put your feet in there, and they just literally it's like some of the exfoliating agents.
Kind of like
that
a
we use.
leech, or I mean, I don't know.
Not as much like a leech in that they'll actually suck your blood.
Yeah, right.
This is actually they'll just literally just eat off the dead tissue.
Wow.
It's a very similar to in medicine sometimes we use medical larvae. And so they will actually help debride necrotic wounds, where we put eggs in there and the little worms will grow, and they will do that. And so this is kind of a similar thing in that the fish actually will eat the dead tissue. Now they don't eat anything living, and so they're not going to hurt you.
Right.
And so it's something where there's no real harm in it other than just losing
How long do
dead
you have
skin.
to keep your feet in there, though?
Yeah, good question. I don't know. Maybe 20 minutes. I don't know.
Okay.
I've
Are
never
they
done it.
like
Lynn, that's
little
interesting.
piranhas or what?
Yeah, no, they're very small. I don't think they have very sharp teeth. But literally, it's just some women will. Well, I say women because men aren't do that as much. But in the shower, you exfoliate with some type of a rock.
Sure.
Or sometimes they get like an acid peel
Right.
that removes that outside layer of skin. The fish are supposed to do the same thing.
Okay.
It's just eat off that dead layer of skin.
Very interesting. I'll have to look into that a little bit and come back with some information. to see what medical research is talking about that. Good. Another question?
We're up to date.
Before we talk, I just wanted to give the listeners a little bit. I know that you, just an aside from podiatry for a minute, your family, your background is into raising bees. Maybe talk a little bit about that and honey.
Yeah,
that's interesting.
It's very interesting. The honeybees, my father and uncle started it years ago.
Wow.
And they initially started in Preston, Idaho. And they started a bee farm. Their father actually raised bees as a hobby up in Wyoming, and they decided to make it into a business.
Wow.
And then as things progressed, they actually took half of it, which included me and my family, my father and my family, up to Alberta, Canada. And we raised bees up there for about 13 years.
Wow.
Then now it's all back in Idaho, Preston, Idaho, where they raise bees. In the summertime, they get a crop, honey, clover honey. And then in the wintertime, they take them actually to California to pollinate the almond groves.
Isn't that interesting?
And now it's my brother and my father that are in it. My father's on his way out towards retirement, so my brother's kind of taking over the reins of the farm.
How much honey?
Yeah.
In a season, do you get?
Yeah, in Idaho, about 50 pounds per hive, and so
50 pounds per
you
hive.
see,
Wow.
and one little colony is like 2 boxes. They'll produce about 50 pounds. One of the reasons why I went up to Alberta, Canada, is that up there, even though the summers are shorter, a lot more flowers, and we could get about 300 pounds per hive.
Oh, wow.
And so a lot more honey per colony, if you will.
Interesting. Now, I understand that for people who have allergies, especially in the local area, it's important to get some local bees. Does that help? Do you know anything about that?
I have read about that. I don't know if that's been officially documented in any type of medical literature. However, the recommendation is that if you do have allergies, buying local honey, eating it, because there's a lot of pollen, a lot of those
It helps
antigens.
to kind of get your immune system to respond to the antigen so that your body develops antibodies so that you can then fight that.
Yeah. Yeah, so they've been doing that, still doing it to this time. Most recently, I think my brother just got back with most of the bees from California, Modesto area, where they're pollinating. And one very interesting thing that's happening with bees is there's actually collapsing colony disorder, which is a new thing. Well, relatively new, but the bees are kind of in danger. There's been a lot of research to it where the bees are being weakened by some type of virus or mite, parasite, and the numbers in America are on decline.
Wow.
Now, the reason why that's significant is that 1/3 of the world's food supply relies on the honeybee. And so if the honeybee becomes extinct, then we'll lose 1/3 of our food supply in the world, which is a big deal. And so my father and my brother have been kind of involved with that a little bit.
That's interesting.
Trying to treat that where
Wow.
There's always been things that affect the bees, bacteria and whatnot, and we medicate with. But as time goes on, some of those things have become more resistant to treatment, just like in people, bacteria.
Sure.
We have,
like MRSA,
yeah,
right?
Yeah, absolutely. And so that's something that's been kind of going on with the bees lately. In that people think of honey and they think of honey, but the big thing the bee does is actually pollinate.
So that other foods and things can grow.
Yeah,
right?
Almonds, apples, cherries, all that stuff. Everything that requires pollination, bees do it better than anything else does.
Wow, that's interesting. And it's packed with nutrients.
Yeah, absolutely.
And we talk about that on Doc Talk a lot on the website. So that, by the way, anybody that is interested, log on to our new website, doctalkradio.com. Every day we have posts, and we'll have excerpts from this show and all of the shows that we've had. We have probably close to 100 video excerpts now on our YouTube channel, which is Doc Talk 1. So check it out. That's great. Did you have a question, Joe?
We do. We have Mark from Gilbert that called in. It said, great show. And talking about bees, Mark wants to know, he's always been interested in bee sting therapy. Do you do that for foot issues?
I don't. However, there was some research years ago on multiple sclerosis with bee sting therapy. We actually had a gentleman who bought a beehive from us. He was diagnosed with the disease and would sting himself. And there's some evidence that the bee sting has some anti-inflammatory properties. As children, we used to actually sting ourselves.
Really?
Yeah. We'd have a sore knee and we'd sting ourselves a few times. I don't know if it worked or not. But yes, there's some evidence that there is some anti-inflammatory properties in the bee sting. I haven't found any patients that want that yet in my practice.
For those of you listening or watching, I'm squirming because I have a fear of bees.
Yeah.
I'm allergic to. I got bit in the mouth once by a wasp, and just thinking about it, it just my heart is palpitating right now. So that's
the stings, they're no fun.
Yeah, that's crazy. Anything else, Joe?
We're good.
Okay. Let's, we're really moving on. Anything else? Let's talk a little bit about stress fractures. Fractures for a moment. Incidents. How often do you see it?
Stress fractures can happen in the foot and the ankle. Sometimes you can get it in your tibia or your fibula, but for the most part, ones we see are in the front of the metatarsals. I'll show the foot model through here. Usually it's these bones through here.
Mm-hmm. So the smaller bones.
Yeah, the smaller bones. What happens is as people are walking, and a stress fracture is just an overuse syndrome.
Okay.
And so just like we can take a paper clip and we can bend it, eventually it will kind of crack, eventually it will break in half, it becomes fatigued, the bones will do the same thing. Now, they're designed to heal themselves. However, sometimes the stresses are such that they're overwhelming the healing properties and the body can't heal itself fast enough, and eventually will have a stress fracture.
Right.
People come in quite commonly with pain in the front of their foot, some swelling. They can have the precursor to their stress fracture, which is the pain, or quite commonly they'll come in and like, my foot's been sore for a few months, it's getting worse. Mm-hmm. Now it's swollen. We'll take an X-ray, and the bone's actually cracked, physically just broken.
Wow.
We can actually see it on an X-ray.
Does that give you any insight into other pathology, osteoporosis, osteopenia? I mean, what?
Yeah, absolutely. I do have some patients who do have osteopenia, osteoporosis that are more prone to developing stress fractures, and I've had them, and quite commonly it'll happen, and we'll kind of send them, and we'll get a DEXA scan and a bone density test, and we'll find that.
Now, do you do that on all of your patients that come in with a stress fracture?
I don't. Only if it's an issue where it seems like we're having a hard time healing it, or they're getting another one.
Okay.
We sometimes will order that test. Mm-hmm. And the stress fracture comes from, again, just it's an overuse thing. Some people are more prone. Kind of two things that kind of lead to that. People that are on their feet more and have a foot that's going to flatten out more than it should. Mm-hmm. Also, sometimes people have tissue that's too tight, and so as they walk, force doesn't go through the foot correctly. And so instead of going through the foot and exiting the big toe where it belongs, it goes through these smaller bones. Mm-hmm. These smaller bones are just much less as far as anatomy goes, and they're just not cut out for all the pressure, and they can eventually fatigue,
right,
and they can stress, and then they will crack.
So really what I'm hearing is just because somebody has a stress fracture doesn't mean that they have other underlying problems necessarily, metabolic problems.
Yeah, not necessarily.
Okay.
It can be. However, not necessarily.
But not necessarily. Okay.
Yeah.
Okay, good. Question? Oh, I thought you had something else. Brad, is there anything else you want to talk about? Anything else that comes to mind that you think our listeners might be interested in hearing about?
One thing people talk about a lot is just tendinitis that can happen. Mm-hmm. We've talked about plantar fasciitis, bunions, which are inflammatory processes.
Right.
Tendinitis can occur on the Achilles tendon. Quite commonly, will get sore where it hooks in the back of the heel. Some of the tendons around the outside of the inside of the ankle can become inflamed.
Right.
And it usually revolves around either a foot that flattens out too much, it's not supported well enough, or sometimes the tissue that's too tight. People are great about exercise, they're not great about stretching, and so sometimes tissue will become excessively tight because the muscles get so strong.
Mm-hmm. So stretching is very, very important. Let me ask you, do you recommend, again, there's two schools of thought, people who run a lot. Stretching before you run, sometimes people say, you don't want to overstretch. What are your thoughts for the foot, especially for the Achilles tendon?
As far as it's good to get warmed up before you start to get active.
Mm-hmm.
If you stretch too much, you're going to make your joints potentially hypermobile, and you could get more prone to injury.
Right.
And so you don't want to excessively stretch, but it's nice to do a little stretching. Sometimes even just walking on a treadmill to get loosened up. But yes, something to get loosened up. Mm-hmm. For example, Achilles tendon ruptures. Every year we always wait for the weather to get cooler, and then we start to see these people come in that are getting more active, and usually they're men that are 35 to 40 that just decide, I'm going to go play volleyball, I'm going to go play basketball.
Like a weekend warrior.
Yeah, weekend warrior, and they just get there and get right after it without getting warmed up, and the tissue will actually pop.
Wow. That's painful.
Absolutely. Mm-hmm. Yeah, and so yes, definitely warming up before you get really active, especially activities that are start-stop, volleyball, basketball, that type of thing.
Right. Cold feet. Let's talk about that for a minute.
Yeah.
Because I'm thinking, and what brought that into my mind was circulation.
Yes.
There's some people that just have their feet are always cold.
Yeah.
What do you, as a podiatrist, think about that or recommend, if anything?
Yeah. Of course, cold feet is just for the microcirculation, little capillaries that are maybe not as effective. Mm-hmm. And so, sometimes cold feet can give us an idea there's some type of significant problem.
Right.
Peripheral vascular disease, and there's a big deal with, not getting enough blood to the feet, which can also correlate to cardiovascular disease. Mm-hmm. And so that's something that if someone has cold feet, we need to make sure that their pulses are there and that they actually have good pulses, and that's the issue. We don't need to worry about some of the other more serious issues like the heart and whatnot, and then kind of deal with this locally with the feet themselves.
Right.
Some people are just born with feet that are just cold.
Right.
And I just recommend that you wear, if your feet are cold at night, wear socks. Sometimes I'll have people actually soak their feet before they go to bed because it will help dilate the vessels and help kind of warm it up.
Right, and not a whole lot more to do other than that.
No, there are some medications that can kind of help with the flow through there. They help with the just increase that circulation a little bit. Those are ones that are usually more when we have advanced issues and we have more cardiovascular issues where we want to have some type of...
What comes to mind would be Raynaud's, and, some of those other vasomotor type things.
There are some of those, yes, those that occur that are a little more serious.
Right.
But as far as a general rule, my feet are cold, wear socks.
Make sure you have good pulses, and other than that, I know for me, my feet tend to get cold, and so that's good. Do you have a call?
Yes, Lance just moved here. Just moved to Tempe. He had a broken foot in the past and has continued foot pain. Would like to know your website info because he wants to make an appointment, and he says he wants to thank the lady from SRP for giving him this show information.
Oh, great. Very nice.
Yeah, and as far as the website, we're impressionfoot.com, I believe. If you just Google for impression foot and ankle, it will come up. And then as far as having an injury and having a fracture, fractures themselves can sometimes ache after they occur for months to even years. However, if you did fracture a bone that was around the joint, could have damaged the joint surface, which can lead to arthritis. That's something that's a little more significant, and it could progress and get worse in that if the articular surface of your joint is actually damaged with the fracture, it could be something that's permanent or could require more medical attention.
Right. Reflex sympathetic dystrophy, is that something that you see commonly?
We do. That is something that you don't want to catch.
Right.
It is basically a painful nerve syndrome that happens. It can happen after
post-trauma or post-injury.
Yeah, post-trauma. I had one gal with stubborn toe. She developed it.
Ooh.
We sometimes see it after surgery, but it is something that if we start to see it in our clinic, we refer it directly to a pain specialist to kind of help manage that painful process.
Right. Good question.
And for you wanting the website out there, just in case you didn't catch that, it's impressionfoot.com.
Oh, there you go.
So impressionfoot.com, check it out, and meet Dr. Neuswander.
Very good. I got to tell you, Dr. Bradley Neuswander and his group, they're excellent. So I just want to make sure that you know that we recommend. I send my patients to you. Hopefully, my family, will be referred to you. So that's great. Anything else, Brad? Did you want to?
The last thing we could talk about is foot orthotics. Now, one thing about foot orthotics is that sometimes in podiatry we kind of get a reflex of you need an orthotic. Right. Not everybody needs an orthotic. However, there are some things, some feet types that people would benefit from an orthotic. And what it is basically is just a shell, plastic, or different materials that go into a shoe that help support the shoe, make the shoe more supportive, and help just control some of the extra flattening of the foot.
Okay, I was going to say, do you have to get fitted for that? Because if you go into the Walgreens or CVS, there's all kinds of foot, inserts and so forth. Give us a little information on how to discern what, how do you choose what's best, or do you recommend coming to a foot specialist and getting fitted for that? Yeah,
there's a lot of products in the market, from supportive to cushioning, and so that can be overwhelming.
Right.
As far as a custom foot orthotic versus an over-the-counter product, a custom product is when I physically will mold your foot, and from that mold I will generate an insert.
Right.
It's more expensive because it requires a more process. And so if people don't want to invest as much resource, then we usually start with an over-the-counter product. They can be effective. They're not going to be as supportive and as durable as the custom is. Right. However, they do offer some good support. As far as picking a good one out there, you go to Walmart, Walgreens, and look in the foot section. There'll be dozens of them. It's hard to pick that out. And so if there is a question, probably it's best just come in and talk to a podiatrist. Most podiatrists will have an insert that's an over-the-counter product that they like, that they have in the office, and there can also be potentially a custom orthotic, which we try to sometimes see if the insurance can actually pay for that, which is nice.
Okay, that's good.
I don't know if you answered that because I was on the phone most of the time, but Bert from Mesa says his chiropractor said absolutely do not use the machines at Walmart. Is that good information, or should you make an appointment to see you, or is that okay?
The shoes at Walmart, the pressure sensors, they're going to give you one of like 4 different inserts. The advertisement is custom, which they're more custom than just pulling off the shelf. If you have a severe foot problem, you may find some benefit with the machine at Walmart. However, probably seeking a professional would be a better way to go.
Yeah, it doesn't take the place of seeing somebody to really get a good assessment of the foot, get it fitted, get a custom. So yeah, that would be obviously my recommendation from that standpoint. For those of you that don't have necessarily foot problems, but really want to just find something that makes you more comfortable during the day, it's probably not a bad idea just to go in and try something. Is that what you're? Is that what I'm hearing?
Yeah, absolutely. You know, a little more support.
Right.
It can make things more comfortable. You know, foot orthotic is something that will give more structural support. So if you have a foot problem, it's going to give you support. If you don't have a foot problem, maybe just your feet are tired. It will give you a few more hours on your feet before they get tired because it just helps support
For
them
nurses
better.
and people that are on their feet for
Absolutely.
long periods of time. You know, that leads to proper shoes for people who exercise, leading to shin splints and those kinds of things. Can you just talk a little bit about that? Anything that you want to say to help prevent shin splints and so forth?
Yeah, you know, as far as shoes go, you know, for your runner, there's specific running shoes.
Okay.
If you're someone who goes to the gym and uses a lot of gym machines and doesn't run, there are actually cross trainers that are specifically designed for that. One thing that happens to a lot of people is they'll do like Stairmaster or an elliptical machine, and their feet will fall asleep on the bottoms. That's very common.
Yeah.
Why that happens is the foot never leaves the pad, and so the tissue on the bottom of the foot becomes hypoxic, and the blood gets pushed out of it, and it falls asleep.
So it's the wrong shoe for that exercise? Is that what you're saying?
Yes, in that there are shoes that are designed to help the tissue breathe better. Actually, New Balance has a shoe right now. I actually just bought a pair that I've been trying, and they actually work. That are just a little more forgiving, and the tissue on the bottom allows
And it allows your foot to move and breathe a little bit better?
Yeah, it allows the blood supply to be maintained in there.
Right.
And so there are some, cross trainers, and they're built differently than a running shoe. A running shoe's built for the heel striking and roll off the toes. As a general rule, a lot of shoes out there, I typically recommend Asics and New Balance. I like Brooks. There's a bunch of people that make good shoes. As a general rule, it's easy to find a New Balance or an Asics or Brooks at most of the stores around.
Right. Very good. Yes.
Sue from Mesa says she has an extra wide foot with hammer toe.
Okay.
And I don't mean to laugh, by the way. Can never find a good pair of shoes because they just don't fit right in the front. Help. She says, help.
Yeah. That is a big problem. A couple places I like. I mentioned before in the show the New Balance store that's by the Chandler Mall. It's kitty corner to the mall. It's by the Lowe's over there. I send people there all the time. They got a great staff over there. They're real knowledgeable. They can measure the foot and find a shoe with a deeper toe box. Another place I use.
So that's the key, is really finding a shoe with a deeper toe box.
Yeah.
So for what was her name?
Sue?
Sue. If you have an extra wide foot, on top of that, a hammer toe, that's really what you want, is to have that toe box to be wider.
Yeah, and the toe box is, of course, the covering that covers the toes.
Right.
A normal shoe could be this thick, but a deeper toe box is just deeper.
Okay,
Just
and you're
has more-
saying that New Balance tends to make the shoe
They
that
usually
way.
have a nice, generous toe box.
Okay.
And then the other thing to do would be to go to Hangers, a place in town. They can actually do what we call an in-depth shoe, which specifically has a deeper toe box. Arizona Walk Shop at Mesa does. They would have a little more variety and can provide a shoe with a deeper toe box. There's actually a shoe that's Brooks actually makes a shoe specific with a deeper toe box, and you could actually buy that at like Arizona Walk Shop type of thing.
Very good.
And then, of course, if you go to those places, you've got professionals there that can help you.
They can help you
measure your
size
foot.
it and measure.
Get the right
Very
length
good.
and right width and stuff.
Okay. Do you believe that our show is just about over?
Is it already?
I told you this would really go quick. We have a minute or two just to wrap up. Anything else that you want to tie up and wrap up and tell us about?
I don't know if I have any other burning thoughts other than, if your feet hurt, see a doctor.
Absolutely.
Come see me. I've got a great staff. There's myself, Dr. Anderson, Dr. Clement there that are all podiatrists.
Right.
And or if you don't live in this area, anywhere, go see a foot specialist. And that there's a lot of treatment for painful feet.
Right.
And so I would say just don't sit home and suffer when there's a lot of professionals that can help with those things.
Just in closing, I just want to ask you about corns. We didn't really touch on corns. What do you recommend as a specialist for corns? Because there's over-the-counter stuff that we can use and the corn pads and so forth. Give us just a little.
I don't recommend the corn pads. They usually have a type of acid in it that will sometimes can burn the skin, sometimes can give open sores. Corns develop from pressure. Usually it's from a hammer toe or a bony prominence that will rub on a shoe or something, and so literally just callus forms.
Right.
And on toes we call it the corn, and so it needs to be shaved off, typically by podiatrists, of course, do that, and accommodative shoes with a deep toe box, sometimes padding, and ultimately sometimes when toes are crooked and they develop corns, they need to be surgically straightened. That's kind of the end treatment of a corn. If it continues to be painful despite trimming it, despite patting it, and then just straightening out the toe, and then once you straighten the toe out, typically the corn does not recur.
Then it goes away. So the take-home point, just one thing that I want to say in closing, is that especially if you're a diabetic, you don't want to trim or cut or shave your own toe, your own foot, because that can really lead to some problems and infection. We have had patients come in who, take a razor and just do it themselves, and that can really lead to some problems and infections. So if you do have those kinds of problems, seek out a podiatrist. It's not going to hurt to get, another opinion. And with that, Joe, if there's anything else? Okay. Well, thank you so much Brad, thank you for being here.
Yes, thanks for having me.
It's been a great show. Good. This concludes Doc Talk Radio with Dr. Ann Borik. Till next time, I wish you health, wellness, and many blessings.
Doc Talk Radio is brought to you by Gilbert Hospital and Florence and Anthem Hospitals. Topics discussed are for informational and not intended to substitute advice from your personal physician.